So lately we've been hearing a lot about the sport of pickleball. It's becoming a much more popular sport across the country. Seems that everywhere there's tennis courts, there's more pickleball courts popping up. We're also starting to see a lot more injuries associated with pickleball. So we wanted to just kind of do a quick little video to tell you about some of the common injuries we see with pickleball and also some things you can do to help to prevent those injuries. So some of the most common injuries that we tend to see with pickleball are injuries related to the lower body. Most commonly, plantar fasciitis or pain at the bottom of the foot, usually in the heel, Achilles or calf injuries, and knee injuries. In the upper body, we tend to see more injuries associated at the elbow, what's typically classified as tennis elbow, as well as injuries to the shoulder, most commonly rotator cuff injuries. Most of these injuries are easily avoided by just making sure that your body has the correct level of fitness before going into pickleball, and so that your body can tolerate the demands of that sport. So the first step in any kind of injury prevention as you're getting ready to start a new sport, such as pickleball, would be to make sure that your body has adequate mobility before getting started. So again, working from the ground up, some of those most common injuries that we see at the lower body would be at the foot, Achilles and calf or ankle, and also at the knee. So making sure you have adequate mobility at the ankle and at the knee, as well as even at the hips, would be the first step toward injury prevention. So the first thing you want to look at is the range of motion that you have at your ankle. Now, normally we consider 20 degrees of dorsiflexion as being the ideal range of motion that you should have at your ankle. So what does that mean? Well, if you look at your foot and you're standing up, your ankle would be about at 90 degrees. Dorsiflexion would be your ability to take your foot and kind of pull it back towards you, and you should be able to get an additional 20 degrees of that motion after that 90-degree position. So if we were to look at the ankle range of motion that Ren has, the easiest thing to do would be have him sit on the floor. You can see his ankle is at about 90 degrees right now. That would be the position the ankle would be in if he was standing just normally. And so now what I'm going to do is I'm going to have Ren dorsiflex his ankle. So he's going to pull his foot back toward him, and we want to see if he can get 20 degrees of additional range of motion. So in this case, Ren doesn't seem to have quite 20 degrees. So in my opinion, this would make him susceptible to an injury at either the foot or the ankle, specifically at the Achilles and calf. And this would be something we would want to start with making sure he's got adequate mobility there at the ankle to help to prevent some of those injuries. The next region we want to look at for range of motion would be the knee. So normal range of motion, the knee is considered to be about 130 degrees of range of motion. So if you were to look at your knee in a standing position once again, obviously with my foot directly underneath me, that would be 0 degrees. So my knee is completely straight. 130 degrees, the best way to sort of think of that would be your ability to grab onto your ankle and pull your heel up toward your bottom. If you can get your heel to touch your bottom, then I would say that that is a normal range of motion. Anything less than that, again, would be slightly, less range of motion, which means, again, you would be at risk for an injury at the knee. So working on that mobility with that simple kind of good old-fashioned quadricep stretch would be a great way to help to prepare that knee for beginning a sport like pickleball. We're going to look at Ren's hip to see if he has adequate hip mobility in order to begin playing pickleball safely. First thing we're going to do is look to see how far I can bring his knee up to his chest. Now again, normal range of motion, what I typically look for is how close can I get the thigh to the rib cage. Anyone who can touch their thigh to the rib cage would be certainly adequate range of motion. Slightly less than that is still reasonable, but if they can't get past 90 degrees of hip flexion, that usually is a red flag for me, meaning that you're at a higher risk for injury at the hip. So to look at that hip flexion, we're going to bend the knee, and we're just going to bring the knee up toward his chest to see if you can get that thigh on or close to that rib cage. And you can see he certainly can get past the 90 degrees. So this amount of range of motion, I would say, would be adequate to begin a sport like pickleball. The next range of motion we would look at is to see how much he can rotate the hip. So to begin with, we'll turn his foot to the inside, and we want to see if we can get at least 45 degrees. So if we start with his foot kind of directly under his shoulder, call that 0. We want to be able to get halfway to 90 degrees, and Ren can easily get there. So once again, I would say Ren has plenty of range of motion that I would not be concerned with an injury to his hip in that range of motion. Next one would be to look at internal rotation, and that's just turning the leg the opposite way. Usually there's a little less internal rotation than external rotation. So I always think of like 35 to maybe 40 degrees of internal rotation as adequate. And again, I think Ren's hip range of motion is pretty good there. Anything less than those values, again, would mean that you're tight in the hips, could be putting you at risk for an injury as you do something like a dynamic sport such as pickleball. After looking at the range of motion of the lower body, the next thing we would do is we would look up at the upper body. Again, the most common injuries in the upper body would be at the elbow in the form of a tennis elbow, which is an injury to the muscles on the outside of the elbow here, mostly because of the way that you kind of swing a racket and have to move the wrist or turn the hand over as you make contact with the ball. And the other one would be at the shoulder, being most commonly the rotator cuff. So again, to look at the range of motion at the wrist would be the way to evaluate a wrist for tennis elbow. So the best way to look at that would be to look at the wrist and to see how far we can flex the hand down with the elbow being straight. So again, normal range of motion would be able to flex that wrist down to fairly close to 90 degrees. And you should feel a little bit of a tightness up there at the wrist, but it really shouldn't be that strong of a pull. So as long as you're getting a little bit of a stretch there and can get fairly close to 90 degrees, I would say that's adequate. Anything less than that or a very strong pull in here, again, could leave you susceptible to a tennis elbow or an injury at the elbow or forearm. For the rotator cuff, fairly simple to look at here too. We would just look at general range of motion. What I usually use as a general test is to have someone see if they can reach up behind their back and touch their opposite shoulder blade. If you can touch your opposite shoulder blade in that way with little to no stretch or tightness in the shoulder, then you would have adequate range of motion that would help to protect that rotator cuff. The other one to look at is your ability to reach above your head and touch your opposite shoulder blade. An inability to touch that opposite shoulder blade or significant tightness or discomfort, again, would be an indication that you don't have mobility in the shoulder that could leave you susceptible to a rotator cuff injury. So for the stretches on both of those different areas, for the wrist and elbow, the easiest one is to do exactly what I just demonstrated, just gently pulling down on the fingers and wrist in order to feel a slight stretch there in the forearm and up into the elbow. And for the shoulder, there are several different exercises you can do, but the ones most commonly that I prescribe are just the good old-fashioned shoulder stretch where you pull the shoulder across your chest, where you can feel a little bit of a stretch into the shoulder here. And then what we do is we also stretch the pectoralis muscle, which is usually done best in the corner of a room where you put your arms on either side of a wall and kind of lean into the corner in order to stretch the chest out. So those are some great mobility exercises to help to minimize your risk of injury as you begin to play pickleball. Once you've determined that you have adequate range of motion, which helps to reduce your risk of injury as you start playing a sport like pickleball, or you've resolved some of your lack of range of motion, the next step would be to start to condition your body for the specific demands of that sport. So in a sport like pickleball, what makes it such a demand is typically because of a lot of the lateral movement that's involved, the changing direction or stopping and going, and also your ability to be up on the balls of your feet so that you can move quickly and agile. So some of the exercises we use that will really help to improve your agility, your ability to get up on the balls of your feet and move into different directions are agility ladder exercises. So we have an agility ladder here on the floor, and keep in mind if you don't have an agility ladder, there's nothing magical about the ladder. A lot of these things you can do with kind of an imaginary ladder, or sometimes have people, if they have tiles at their house, they can use the tiles on their floor to kind of simulate a similar exercise. But often just simply kind of reproducing these similar patterns would be basically the same idea. So Ren's going to demonstrate a couple of exercises that would help you to improve that agility. So as you see, as Ren's in there doing the agility exercise, he's up on the balls of his feet. His heels are not really touching the ground. In this case, he's just kind of moving laterally, which is often the type of movement that's used in a pickleball match. Again, same thing on this one. You can see Ren's up on the balls of his feet. Heels are not really making contact with the ground. Now he's getting just small little kind of lateral movements, but staying mostly kind of in a forward moving pattern. Right. So those are simple exercises that you can do just to start to help to build some strength in that lower leg, the calf, the Achilles, and even the muscles under the bottom of the foot or through the arch. Okay, so we talked about some agility exercise because that's generally the way you're going to move around on a pickleball court. The other thing we want to do is to fortify the hip and the knee, because some of the times when you're playing pickleball, there are some shots that you have to kind of get down low in order to get to, which puts you a little bit of stress on those knees. So the best way to train for that is to just do good old-fashioned exercises such as a squat and a lunge. Keep in mind that in a sport like pickleball, you don't need a tremendous amount of strength. So I don't see a real need to use a lot of weight for these exercises. It's really just making sure that the knee and the hip can tolerate kind of those deep bends. So for Ren's just going to demonstrate just a kind of a classic squat exercise. So feet about shoulder width apart. And he's just going to kind of squat down, and you can see he's bending both at the hip as well as at the knee, which helps just to make sure that those muscles can tolerate that depth of movement, which sometimes is necessary to get some of those low shots. Now, most likely in pickleball, when you're going for those shots, it's rare that you would have both feet on the ground at the same time. So sometimes I would almost think a better exercise would be something that simulates what you would need to do on a pickleball court, maybe a little bit better. So I actually would rather see people do something more like a lunge exercise, because lunges really help to simulate more of that actual mechanism of how you might get down low for a shot on the court. So Ren will just kind of demonstrate a classic lunge exercise. And so you can see he's just simply stepping forward, dropping the back knee down to the ground, helping to kind of prepare both the hip and knee for kind of those single leg, kind of low positions that you might find yourself going into to get to those low shots. The other area that we see some injuries with a sport like pickleball, like as we've mentioned, are at the elbow and at the shoulder. My feeling is that a lot of those injuries tend to be because of poor technique when you're striking the ball with that paddle. So in this case, instead of really focusing on trying to build strength at the shoulder and at the elbow, I think what's more important is to develop better technique when you're swinging your paddle, or racket. So in this case, what you want to avoid when you're doing any kind of a racket sport is to really avoid just allowing yourself to swing using your arm. So if I demonstrate that, that would look something like this, where I'm really just kind of swinging my arm in order to make contact with the ball. Instead, a lot of that power comes from the torso or the core. So instead of swinging just with the arm, better technique would be to develop the ability to kind of really rotate at the torso. And you can see in this case, there's actually very little movement happening at my shoulder, so that I'm creating less stress at the shoulder itself. With the elbow, there is some wrist kind of action that is necessary there. But again, proper technique with how you're holding the racket or paddle, or how you're actually kind of swinging it. If you're using excessive motion at the wrist, there's where you're going to tend to find the injuries to the elbow. So in these cases, I would recommend, maybe consulting with a coach that can teach you the proper technique for swinging, because that's probably going to be the better way to avoid those injuries rather than trying to build a tremendous amount of strength in those areas. So proper racket swing technique is really kind of the most important thing when it comes to the injuries of the upper body in a sport like pickleball.